Many people with diabetes are at risk of developing wounds on their feet that just won't heal. They're also at risk of getting hardened arteries in their legs, a condition that can be very painful. These issues are what cause some diabetics and some people with peripheral arterial disease to need amputations. But doctors at Mayo Clinic are using a special boot to help prevent amputations and save limbs. It's called a Circulator boot. John Bergman wears it 5 mornings a week.
It feels good, almost like a massage, in fact.
John has poor blood supply in his legs, and because of that, a wound developed that just wouldn't heal. It started small, but without enough nutrient-rich blood flowing to it, the wound got worse.
At one point, it was about 13 inches long and 9 inches across.
Blood supply is the most important thing for wound healing.
Dr. Karen Andrews says if wounds can't heal, they can get infected, and this process could lead to an amputation. But the Circulator boot is helping to save limbs.
And we actually studied it and found that we were getting good results. We were saving limbs. We were healing wounds that had been present for months.
Here's how it works. Every time your heart rests between beats, the Circulator boot fills with air and compresses the leg. This sends nutrient-rich blood through the arteries toward the foot, helping wounds heal. The compressions also push blood through clogged arteries and help form new pathways for blood to circulate. Then it brings blood back to the heart to be oxygenated again. It's working for John.
Today, the wound is down to where it's, about like an egg, about that big.
And John's able to walk through life knowing his leg is healing. Dr. Andrews says the Circulator boot may not be right for everyone. People with blood clots in their legs or people with certain levels of heart failure should not use it. But for many people, the Circulator boot may help avoid an amputation. Dr. Andrews also wants to let people know that if a leg cannot be saved, people can do very well with amputations. Surgeries are state-of-the-art, as is the development of prosthetic devices. Now keep in mind that not all types of leg compression devices are designed for these problems, and some can make things worse. So before you start any compression therapy, talk to a doctor. For Medical Edge, I'm Vivian Williams.